Welcome to Season 17 of Marrow Masters, sponsored by Insight and the Leukemia and Lymphoma Society. This season focuses on adolescents and young adults, or AYAs. They are often caught in the middle, too old for some pediatric practices, but much younger than other cancer survivors in an adult clinic. We'll be talking with a variety of speakers this season who will share their best tips, tricks, and ideas for this unique segment of the population. Our guests will offer grit, honest feedback, advice, hope, and so much more. Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Hello, everyone. So today we have with us Chris Dandoy, MD, MS, Associate Professor of Clinical Pediatrics, Bone Marrow Transplantation, and Immune Deficiency at Cincinnati Children's Hospital Medical Center. So Chris knows plenty about AYAs, and he is going to share his expertise today about this very special age group, sharing their challenges and important ways that we need to better empower them in managing their care. We all know they want a happy, fruitful, productive life post-cancer. Welcome, Chris.
Thank you, Peggy. It's wonderful to be here.
Let's talk about your role at Cincinnati Children's Hospital, and I also want to hear more about a very special program that you are a part of.
Perfect. My name's Chris Dandoy. I'm a bone marrow transplant physician at Cincinnati Children's. I've been attending since 2014 and currently an associate professor. My clinical practice primarily involves autologous stem cell transplant for children as well as adolescents and young adults. And I do transplants up to 35, 40-year-olds for pediatric tumors. And then I also do transplants for patients with leukemia and that require an allogeneic transplant. Okay. And then also cellular therapy such as CAR T. On top of my clinical care, I am the executive director and founder of Engraft, which is a learning network. A learning network is a little bit different than the traditional consortiums that we normally think about. A learning network is a group of both physicians and healthcare providers, as well as patients, families, industry partners, and nonprofit organizations working together for a common goal. And our common goals are to improve survival after stem cell transplant, as well as improve the quality of life of stem cell transplant patients, as well as their families. So this learning network, we get together. There's about 75 to 100 of us now that are actively participating from 15 different centers, both pediatric and adult. We get together, we identify the biggest problems, and then we look at ways to fix them together and learn from each other in real time. We get active communication and participation from patients and families, and then the physicians, as well as the healthcare delivery team, are communicating and learning from each other in real time. So we're not trying to invent the wheel independently. We work together to try to improve outcomes. And it's really exciting. We've been up and running for about a year and a half, and we've already been able to make some great strides in taking care of improving outcomes for our patient population.
That is just great, Chris. Thank you for sharing that. I know that you know better than anybody how uniquely tough it is, this experience for young adults. Many are caught between, pediatric and adult care, independence and dependence. So we're going to talk about how we can help them take better ownership of their own care at that precious age.
Yeah. So first, I think you have to define what does ownership mean. So what is ownership? So ownership is actively participating in your care. You got to ask questions as an adolescent or young adult or adult, understand the medications you're taking and then why you're taking them. And then also be vocal and speak up about your symptoms. The reason why this matters is that if you are vocal and take this ownership of your care, not only are you going to have more control and feel in control of your care, but you're going to have better outcomes. You don't have to know everything. It's about knowing and how to ask, when to ask for help, and then knowing that and how to communicate with the healthcare delivery team. And an example for the Engraft group is central line. That's a big thing that we're working on right now, is taking out central lines after bone marrow transplant.
Okay.
As you know, if you're a survivor or someone that takes care of a survivor after transplant, having a central line in place, it makes it very difficult for you to take baths, showers, go swimming. You have to have the lines scrubbed all the time. You have to have the dressings changed, caps changed. If you get a fever, you have to go into the emergency department. And early on in the transplant process, we need central lines to give you chemotherapy and fluids and blood products. But as time goes by, we don't need that central line as much as we did at the very beginning. So being vocal, talking with your team and asking what are the criteria to get my central line out is a way of ownership of your care and being able to communicate and work together with your healthcare delivery team to impact how that, or to mitigate or move how that impacts you and your outcomes.
Well, that is great advice. I'm so glad we're talking about this. So Chris, let's talk about medication adherence, the challenges and strategies that might help patients out.
So why do we have to take these medications? So every single medication has a purpose. Let's just talk about two big ones. So if you're getting a transplant, an allogeneic transplant, or receiving a bone marrow from someone else, you need to protect that new bone marrow so it doesn't attack your own body and develop what's called graft-versus-host disease.
Mm-hmm.
The medication that we give you several different types. Depends on the center you're at, depends on what kind of transplant you're undergoing. But the reason why we give you that medicine is so it doesn't impact your liver, your skin, and your bowels. If you don't take that medicine, then it's possible or likely that your new graft will attack your body. And that's something that we want to prevent. We don't want to happen. And we want you to be healthy and we want you to succeed. The other is some of these medicines we give you prevent infections. And the last thing that you need during transplant or after transplant is develop a fungal infection or a viral infection. It just adds longer time in the hospital. It adds more chance of you having a bad outcome. So it's hard. That's the why. We don't give it to you unless you really need it. And it's tricky. Sometimes you have 20 pills you have to take twice, 3 times a day, and it's hard. So it's tough to do.
It is a lot. So what are some strategies that might help people with that?
First of all, know that it's normal to have a hard time with taking these medicines. However, you can do it. So the first thing is maybe have an app on your phone that tells you when you need to take your pills. Maybe you put them in boxes. Maybe you have them little cues. Before you brush your teeth or before you eat, you have to take your morning pills. Before you eat dinner, you have to take your night pills. But there's 2 parts. One is know that this isn't permanent, that it's a temporary thing. At some point in the next few months, you're going to be able to stop taking these medicine, but you have to get through it at this time. And the other part is just look for ways to insert it into your daily schedule. Again, first thing in the morning, last thing at night. Maybe it's at lunchtime, whatever works for you, but just have it as a routine that you do on a normal basis. And just remember that it's not permanent. You don't need these for years, but you do need them for this time until you and your doctor decide that you don't need them anymore.
Yes. And, caregivers can be a help with this. Friends, everybody's looking for a way to help you. Maybe having that buddy that just helps you remember that you need to take this or you need to do that. Engage people, right?
That's right. And all of us have friends, maybe not friends that underwent a bone marrow transplant or has cancer, but all of us know somebody or have friends that have to take medications for some reason or another. Look for ways, ask them why they take their medications, how they take their medications. And then if the medications are upsetting, say they upset your stomach or they're hard to swallow, talk with your team, ask to see a pharmacist. Maybe there are other brands that you could use that may be easier to take, or maybe liquid form may be easier to take than a solid form. But again, be vocal. Talk about how you're having problems and look for opportunities to work around and to make it easier for you.
Yeah. So Chris, this just makes me think of how very important it is for our patient, our caregiver to be engaged. Let's talk about how to stay engaged in their own care.
That's perfect. So as an adolescent, young adult, even an adult, there are numbers that the doctors and nurses and care managers are going to be talking about. They're going to talk about your ANC or your counts, quote unquote, or your absolute neutrophil count. Know what those mean. Ask the questions. If you don't understand what a lab means, ask what it is and how it impacts you. For instance, if they say your hemoglobin is low, what does that mean? Well, it means that your red blood cells or your blood cells in your body are a little bit low. How does that impact you? It's going to make you a little bit more tired. You're going to be more fatigued. You're not going to have the energy you need. So if it gets too low, you're going to need a blood transfusion. And then you can think about how that impacts you and how to plan when you're going to get this blood transfusion. Or maybe they're following some of the salt levels in your body. Ask what it means. Ask why they're starting new medications. Learn about the medications and why they're giving it. And then what you need, what time or how long you need to wait before you can get off of that medicine. So again, we're not going to prescribe anything for you that isn't necessary. Just ask questions. Ask questions, try to learn about what you're taking, and then again, how long you'll have to take it and what has to happen so you can stop taking it.
It's almost like they need to go into detective mode.
You do. That's great. That's great.
Right?
And you don't need to memorize it. Write it down. Have a cheat sheet. Use the list that's printed out for you of your medications and write down why you're taking them and some of the side effects of them, and then have that for you yourself so that you can ask questions and work off of it when you have these visits with your doctor.
So let's talk about the wonderful caregivers. Some advice you might have for them today, Chris.
For the caregivers, my advice is that I routinely say to my caregivers is that they've gone through a lot already. This is a marathon, and there are hills and there's valleys in this marathon that they're running, but it will get better. Just to continue on with it. Rely on other folks if you have them, other support system folks to help get through this, but know that it's going to get better. And you're walking beside your child, not behind them.
Yes.
Walk with them, walk beside them, help them along this way. And then as much as you can, do it with them, not for them.
Good.
These adolescents and young adults take ownership of their care and help them to make decisions about what they're doing.
So, Chris, you've been doing this a long time. I feel like you've already been sharing your best advice, but is there anything else, any other pearls of wisdom that you want to convey today?
Yeah, a couple things. Write them down. You're going to forget them when you're in your doctor's office. So write down your questions as they come along. If there are apps that you want to download that may help you keep track of your symptoms, that's not a bad thing. Use those apps, or maybe keep a diary, or, just keep track of how these medications and treatment are impacting you, and be vocal. If you're having a hard time, if there are problems, if you're having pain in your knee and nowhere else, don't keep it to yourself. Talk about it. If you're having a hard time swallowing, please be vocal. Tell us, and know that all of the treatments you're getting have a reason, communicate it, but again, just talk about things and have open communication. The last thing the doctor wants you, or the healthcare delivery team, I should say, they don't want you to sit at home and worry and be anxious about any of this. If you have questions, ask, and we'll help you through it.
Yeah.
So a couple of things just to add on. Transplant's not just a procedure. It's not just a surgery. It's a journey. You're getting your life back. You're getting your identity back. You're getting your power back so that you're able to get back to who you were before and even better. And you're not doing it alone. You are the main focus of your care. So you're the main character. You're the person that we are all working for. Both your parents, your siblings, and the whole team is looking at you and working with you and walking alongside of you. And then you're not just surviving transplant, you're shaping what the future of your health looks like and your tomorrows. And know that those tomorrows are going to be better, and each day is going to be a little bit better than the last. And continue on with this journey. It's going to get better, and you're going to make it. And that's really, I think that's really important to remember.
That is great, Chris. We did a recording the other day, and to echo what you're saying, Emily shared that, you have to do this for a little bit to get your whole life back. And I feel that's just a theme here. This is so hard at the time, and it's so just grueling. But again, it's really a blip. it's a moment of your life, and hopefully doing everything and getting through it and being compliant and trying to find some joy, it will all be worth it, right?
Yeah. And you're going to get to the other side. So
I love that.
I think that's the most important thing.
Yeah, that's great. Chris, do you have any kind of anecdotal story you want to share? Maybe a particular survivor that really just weighed on your heart?
Yeah, happy to. I think of a 22-year-old female, let's call her Jenny, who was undergoing a transplant, an autologous transplant, or she was giving her cells back to herself for a type of solid tumor. During her first part of her transplant, the first couple of weeks were very tough. Developed complications of her transplant that impacted her liver and her kidneys, and she was in the ICU for roughly a week, and it was a hard time. However, as she recovered, she made the slow steps. First, it was just a few steps or sitting in the chair. Then the next were getting up and out of bed and walking around the floor. And then it got to, let's get out of the hospital. And then it has progressed. And now she is back to her normal self. She's running 5Ks. She's out dating again. She's getting back to her normal life. And she is glowing. And I couldn't be more proud of her. I saw her yesterday and gave big hugs. But know that as bad as it gets, it will get better.
Yeah. Oh, Chris, what a great statement. Thank you. Thanks for sharing your wisdom and your heart today. I know that this Engraft is a labor of love, and we are so lucky to have people like you that are taking that on and looking for best practices and to be engaged with so many different centers. And really, like you said, not reinventing the wheel, just taking everybody's best ideas and learning from each other, leaving the egos at the door. And I just think it's fantastic. And we'll be sure to include in the show notes how people can learn more about Engraft.
Oh, that's wonderful. And thank you very much, especially National Bone Marrow Transplant Link, for having me on today. It's been an honor to speak with you.
Well, thank you.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.